Hi, my name is Treasure Farmer, and this is for Current Topics in Kinesiology, KN530. The assignment title for this week is Stabilization Exercises for the Upper and Lower Extremities. My volunteer this week is my mother, so she will be helping me out with that, and let's get started. So starting with the lower extremity, our first exercise we have is a knee to chest exercise. So basically all the patient is doing is slowly raising one leg at a time, their knee towards their chest. Another aspect of this is to get that transverse abdominis activated. So how we do that is to suck our belly button in towards the ground so our back flattens, and that is going to activate our transverse abdominis, which is this muscle right here, activating both the core and the lumbar spine. This exercise will be about 3 sets of 10 and a 60-second rest in between each set. The second exercise we have is bridging. So how this works is the patient will have both feet flat on the ground as they raise their hips towards the ceiling, keeping their shoulders on the ground. Our aim here is to hold the bridge. For this one, we'll go about 5 seconds and then rotate back down. And we'll try to do this about 10 times. Also 3 sets of this with a 60-second rest in between. We can also use that TA activation in this exercise as well. What this is doing is working that glute med and stabilizing the hip as well as some of the lumbar spine as well as the core. So we're doing a lot with this one little exercise. The third exercise we have is a lower trunk rotation. So with this one, the feet are going to be flat on the ground as well. Hands can remain on the sides of you. The aim for this is to not let our back or shoulders come off the ground. Hips coming off is all right because we really want to get some range of motion in that lumbar spine with this. So keeping our shoulders pressed against the ground as well as our back and slowly rotating our legs side to side with a slight hold on each side. Very slow and controlled. Our aim for this one is another 3 sets of 10 with a 60-second rest in between. Our next exercise is just going to be a simple hamstring stretch, and what this is doing is when our muscles are tight, we don't have that range of motion in the hip and joint area. So by stretching the hamstring, I'd like you to hold it for 30 seconds, please. Thank you. By stretching these hamstrings, we're stabilizing the hips as well as some of the low spine. So like I mentioned before, just hold the hamstring stretch and you should really feel it in there. We'll hold for 30 seconds and each leg, and we'll take a 60-second break in between that and do that 3 times as well. Another great exercise for stabilizing the hip is hip extension. You can do this with a band or without. Starting off, you might just do it with your own body weight. So what we're doing is we're just taking our leg and kicking it straight back. You can have some sense of balance. See how she's holding on to this here because her hip flexors are pretty weak. So we would do this 3 to 10 times a day and try to get those strengthened up. And then secondly, after this, we will do hip abduction. So you're going to take that same leg and kick out to the side, making sure our posture is nice and tall, sitting straight up. Again, this should do about 3 sets of 10, 60-second break in between, and then we would switch legs. For our last exercise, I'm going to be demonstrating this one just for safety purposes. So this last one we're going to do is called bird dog. So you'll get in a quadruped position, or basic terminology, on your hands and knees. And as your right arm comes straight out, your left leg also kicks back. So you're here, and this is really working on almost all the stabilization, stabilizing your shoulders, stabilizing your hips, stabilizing your spine, your core, working all of it. And as we bring that down, we switch, and as our left arm goes out, our right leg also kicks out, making sure that our hips are not rotating out or curving in any way, and that we have a proper spine straight out. This is a pretty advanced exercise. To progress this, you can stay here and bring the left knee in, touch your right elbow, and kick back out. And you could do that 3 sets of 10 as well. When you get really good, which I don't think I'm able to do, you can try to stay on, as your left arm kicks out, your left leg can also kick out. But see how I'm rotating? I don't have strong enough hip flexors to do that. So now moving on to the upper extremity exercises. The first one we're going to be doing with is a serratus anterior punch, or some call it like a fencer's exercise. And what we're doing is really trying to stabilize the scapula. So the serratus anterior is a muscle that wraps around and really supports movements of the scapula, like scapular rotation, protraction, retraction, all that good stuff. So it's a very slight movement. So what I like to tell people is you're kind of punching towards the ceiling. It's best done with a weight, but if the weight is too much, we can take that away. Very slight. Your elbow does not bend really at all, or it shouldn't, and it's really focusing more on this shoulder joint and the scapula motion. You can kind of see how the scapula is pushing forward there. We'll do this exercise another 3 sets of 10 with a 60-second rest in between. So since we're already on the ground, our next exercise is going to be a cat-cow position. So first is you're going to rise up into your cat. So her back is being pushed towards the ceiling, and as she comes down into cow, her shoulders are pinching together right about there. You can kind of see where that shirt indents. Really focusing on that shoulder stabilization and scapula, and this is also great for the lumbar spine. Also great breathing technique to do this. Inhale as you're going up into cat, and exhale as you're going down, dropping the head and relaxing all that. This is as well another 3 sets of 10 with a 60-second rest in between. For our next exercise, we have scapula clock circles on a ball. So you're going to get a ball or anything that can be rolled around on a surface. Place that against the wall with our arm not completely locked out, but we don't want our elbow to be bent. Set your scapula so that it's back. We don't want our rhomboids crushing in very much, just in a neutral position. And all you're going to do is you're going to go about 10 clockwise and then 10 counterclockwise. The circle should not be big because that limits our stability of the scapula here. So just small circles on the wall, making sure that there's no bend in our elbow and we're keeping that good, nice and straight posture. Again, this exercise, probably do 3 sets of 10 on each arm. So once we're done with that arm, we'll switch to the other and do the same thing. 10 clockwise, 10 counterclockwise, 3 times. Our next exercise will be a shoulder flexion exercise. So with this, if you have a TheraBand, I just kind of tied it around a doorknob. That worked pretty well. And you get to a tension level that is good for you. With this, your arms are straight. Elbows aren't completely locked out. However, your arms are pretty straight, and you're only going to about this portion of your hip. So mid hip, notice good posture. The shoulders are back. We're not arching forward with our back. We're also not just letting the TheraBand take us back out. We are slow and controlled the whole way in and out. And this is really focusing on that scapular and shoulder stabilization. Again, with this will be about 3 sets of 10 with the 60-second rest in between. So next what we have is a shoulder extension, very similar to the flexion. However, you just flip your body around and grab the TheraBand, and now instead of pulling inward to our hip, we're starting at the hip and pulling out. So really this again is focusing on that scapular stabilization as well as the shoulder. Slow and controlled motions. It's important not to lift our arms too high because that affects our shoulder, just to a good happy medium point and straight back to the hip, no going past any further than the hip. Again with this, 3 sets of 10 with a 60-second break in between. Third exercise we have here is a shoulder internal rotation. So our arm's going to be tucked to our side at a 90-degree angle. Something that I find that helps with this is if you get a towel or anything and you tuck it right under the armpit, it forces that arm to be in that angle. So yeah, you're just coming slightly across your body and back out. Lift your arm a little bit higher at 90. There you go. And stop right here. Yep, stop and back. Good. So this is again another shoulder stabilization exercise. Again, 3 sets of 10 with a 60-second break in between. Next we have a shoulder external rotation. So with that same arm, all you do is just kind of flip around, and now you're starting from this position right here, and you're slowly bringing this arm out, keeping it at a 90-degree angle here. Slowly bringing that arm out and externally rotating your shoulder just to that 90 degrees. So don't go any further past because that could cause further damage in the shoulder. And with both these exercises, you'll do 3 sets of 10 and then you'll switch to the other arm and do the same exact exercises. Again, you can also throw that towel or blanket under the arm to keep that correct posture. And that concludes our exercises for this assignment. Thank you to my volunteer, and I hope you enjoyed. Thank you.